Is now Dr. and Senator Tom Coburn, a great guy. Mark Halpern and I were just saying we wish there were more senators like Tom Coburn who just
speaks truth to power.
Speaks truth to power, whether it's a Republican or a Democrat. He's Republican from Oklahoma. Also with us, Dr. and Senator John Barrasso, a Republican from Wyoming. Let's start with you, Tom. Would you like to? Are you going to ask for the prescription?
No,
now?
I just wanted to give you some perspective. But
okay.
no,
have a nice glass of wine before you go to sleep.
There you go. All right, Tom's figured it out. That's all you're going to get for him.
All right.
Tom, let's start with. We've been talking all morning about why the president's poll numbers are falling. Why do you think that is, as it pertains to health care?
Oh, I don't know. I'm not very good at that. I think people were expecting something different. Everybody in this country recognizes we have some problems with health care and that we need some major changes. But trusting the government as the source to manage those changes is very uncomfortable with the vast majority of Americans. And all you have to do is look at Medicare and Medicaid and see how they're out of control and they have a 20% fraud rate and improper payment rate, and you start wondering about that. So, I don't know why. I'm not sure the two are related, but what I do know is people don't want anybody between them and their doctor, and they really don't want the government highly involved in it. They want the affordability and the prices down, and we can do that without ever raising taxes on everybody and having another 84 new programs, which is in the health bill, new government programs.
Hey, Tom, you're a man of faith. Back in the 90s, everybody was wearing these "What Would Jesus Do?" Wristbands. And I wonder, what would Jesus think about walking into any emergency room in any urban center at 11 or 12 at night and seeing all of these moms bringing their children from poor families who don't have health care, having to use emergency rooms as their primary care? Is that a moral system? Is there a better way to do it? How do we do it? We can't just say no, can we?
No, and we shouldn't, but we're not doing that, Joe. First of all, 90% of those moms with their kids are eligible for either S-CHIP or Medicaid, and we've done a lousy job in that program getting them signed up, and that we ought to have auto enrollment for that. And so therefore the option, since they're not signed up, they're not aware of the benefits of the program, is they show up at an emergency room. It's a terrible place to practice medicine. There's no continuity. You don't know your patient. And what we ought to be doing is, we have several programs today. Let's make those work. That's the other thing that Americans are wanting. Don't change and take away the best healthcare system in the world. Improve it, and don't spend my grandkids' money running it through the government when you can in fact work it better by getting greater value for what we're doing today.
Senator Barrasso, though, is there anything that the president, clearly he has a timeline within which he wants to work politically in order to be able to get anything done on this issue? Is there anything the president can do, even a smaller step on health care through the government, that you think would be constructive toward fixing the problem?
Well, Mika, we do need health care reform in this country. Tom and I have been talking about this for 25 years that I've been a practicing doctor as a surgeon in Wyoming, and my wife is a breast cancer survivor. We know the different sides of health care reform and what we need to do to make the system better. But it's a $1 trillion puzzle here in Washington, because you're trying to save money, but at the same time cover more people. But as David Broder in his column yesterday said, these bills that we're looking at, overly expensive and badly flawed. And Tom and I have a show twice a week called Senate Doctors, and the whole idea is to answer questions. We do it on Twitter and YouTube and Facebook, and people email us in, and the questions that people are asking are just the question you asked here, Mika. Can we take incremental steps, common sense steps, toward dealing with a very serious problem? Because what people want is for health care costs to get under control.
Well, how do we do that?
All your poll numbers show that the same thing. The big thing is cost,
Senator,
not just covering more people.
The question is, how do we do that, though? You and I both know that Medicare and Medicaid go bankrupt in the next 10 years. We can't be incremental in cutting costs. What tough choices do you propose in cutting the explosive rate of growth in healthcare?
I don't think it's hard at all, Joe. I think what you do is you create transparency in the market, one, so that you get to see what you're buying and what it costs. Number two, you reconnect the purchaser of health care with some economic connection out of their own pocket, which oftentimes we have not. And so once you create that transparency, and you also create transparency in terms of quality, all of a sudden we'll have an economic reason to make a decision. We know that 1 out of every $3 that are spent in healthcare today doesn't help anybody get well, it doesn't prevent anybody from getting sick. Certainly we can do better than that.
All right, we want to thank the stars of a new show, the Senate Doctor Show, Senator Tom Coburn and Senator John Barrasso. Thank you very much.
See you
We
guys.
appreciate it.
Watch us today.
All
Twitter
right.
Senate Doctors. See you then, 4 o'clock.
All right, we'll be there. Thank you so much. He was in PR, by the way, before he went to medical school.
Definitely.
I'm
the
watching.
doctors are in.
The
Coming up
doctors
next.
are in, and I'm going to Twitter them too. I'm going to follow them.
I am too.